I'm Christine Radwill, and I'll be talking about veteran healthcare implications. The Veterans Healthcare System is one of the largest healthcare systems in the United States. Currently, the system owns and operates 150 hospitals and 819 community based outpatient centers. Currently, there are 22 million veterans in the United States. The VA is staffed with 12,000 physicians, 900 dentists, and 33,000 nurses. In doing the math, this means that roughly the patient to physician ratio is 1,833 to 1. It is not hard to see why exactly there are such long waiting lists for so many veterans who need to see a physician. Since 2014, there have been numerous scandals in the VA system that have led to investigations at many facilities. A backlog of over 867,000 pending applications for initial care and entry into its system was discovered in September 2014. Further investigation into the backlog revealed that nearly 47,000 veterans died as a result of the long wait for healthcare. And upon further research, it was determined that there are several other issues in the VA healthcare system. These include transportation to get to a facility, financial barriers, and the overall quality of care being provided within the system. In November 2014, an interview was conducted by Scott Pelley in 60 Minutes with the then Secretary of Veteran Affairs, Robert McDonald. He admitted there were phony waitlists in which veterans who appeared to have 2-week wait periods may have been waiting for over 400 days in a Phoenix facility. Some drove thousands of miles, such as one veteran who drove from Alabama to Boston to seek care, and even a physician admitted the ER conditions made it difficult for her to do her job. An investigation led to the conclusion that 40 deaths were due to the waitlist in Phoenix. In July 2014, the Veterans Access to Care Through Choice, Accountability, and Transparency Act of 2014 was passed by Barack Obama for a major overhaul of the system. However, it seemed that even the large amount of money, $15 billion to be exact, did not make a significant difference. The purpose of this bill was to address the following: hire more doctors, nurses, and staff more clinics, to ensure timely care, and to hold more people accountable. Problems continued into 2015 when some 1,600 veterans waited between 60 and 90 days for appointments, and in 2016, data collection from the agency showed that nearly 526,000 veterans waited more than a month for care, and even more startling, 88,000 of them waited more than 3 months. President Trump donated a quarter of his salary to the department in May 2018, and then a month later, a bill was passed known as the VA Mission Act, so veterans can access private care whenever they are unhappy with the waiting time to receive care at VA facilities. Many Americans may think that more of their tax-paying dollars goes towards veterans' health care than what actually does. This chart shows that out of 30% discretionary spending for 2017, only 2% went towards veterans' health care. A study done in 2006 among Washington state veterans who died between the years 1998 and 2002 showed that out of 2,618 females and 59,462 males, only 12% of females and 21% of males used the system within 5 years of dying. The most significant finding of the study was that both female and male users of the VA healthcare services were more likely to die from drug and/or alcohol-related causes than those who did not use the VA healthcare system. Further, a national telephone survey of 3,611 women veterans was conducted. Of those 3,611 women, 18.9% of women delayed care in the prior 12 months of being interviewed, and younger age groups were more likely to delay care than their older counterparts. Due to the problems within the VA healthcare system, it has been made clear that it is failing the health of veterans everywhere. Moving forward, it is important to educate the public so they are more aware of the gaps in funding and the lack of medical staff. Having veterans serve as advocates will help make people more aware of the barriers they are faced with. Offering scholarship opportunities to students seeking medical degrees can be an incentive to have a job upon graduating. Also, having clear plans in allocating money so that it is not wasted where it is not needed, as what happened with Obama's bill back in 2014. And lastly, building more outpatient centers for easier access would be beneficial.